the characteristics of an overuse injury. But what's important to understand that PE and youth sport, the majority of injuries as they happen in each of these environment is of different nature. In physical education, the most common injuries reported are ligament sprains and muscle tendon strains. Simply speaking, joint sprains and muscle overstretches. These are followed by soft tissue injuries like abrasion, contusion, bone and joint injuries, lacerations and cuts, and head injuries. The more serious injuries, although rare but has been documented in physical education, involves injury to the growth plate in the bone, complete tear of ligament, most commonly in the anterior cruciate ligament, as well as and the third injury being concussion or head injury. And why are these serious? Because they can have long-term implications on sports participation, education, health and wellness, as well as incurring a substantial healthcare costs. In terms of injury location, upper extremity is the most commonly affected body part. In terms of the specific body part, ankle is the most commonly injured specific body part, followed by the hand and wrist. The 11 to 14-year-old age group, they have the lion's share of all injuries during physical education. This is also the time when the body is moving through its peak height velocity age or the adolescent growth spurt, and therefore it has to cope with all those challenges of overstretch of the muscle and tendon, the bones becoming weak. So not surprisingly, this particular age group has been reported to have the highest number of injuries as far as physical education is concerned. In terms of activities reported in the Western literature, running and basketball they were reported to be the most common activities. I'm sure if we do this kind of studies in different cultures, like in India, we may see different sports topping the list in terms of activities causing injuries. We have done some studies in Singapore, and what I present to you is a list of injuries reported in primary schools and secondary schools. Now, while we do have a list of injuries, what came as an absolute element of surprise is about 85% of injuries were of common type and nature, despite the children in these two levels of education being at a different level of growth and development. So this is a puzzle that we are still trying to solve, but this ideally should not be happening, because younger children should be incurring or sustaining different types and natures of injuries compared to the older children. So somebody is not doing something right somewhere, but that needs to be solved in due course of time. All right, so after discussing the injuries in physical education, let's quickly discuss common injuries in youth sport. Now, we all know that the period of childhood and adolescence is a period of dynamic change. Kids are learning new skills, they are refining what they have already learned, the bodies are growing, the functions are maturing, they are becoming stronger, faster, their endurance levels are growing, and it's a continuous change. So in this kind of a time window of continuing change, children are subjected to unique risks of injury, and the injuries are also unique, many of which we actually don't see in the adult athletes. In terms of the acute traumatic injuries, sprains and strains and fractures are at the top of the list. That means the joint injuries, overstretch of the muscles and bony injuries. Ankle, knee, elbow and shoulder are the most commonly affected body parts as far as youth sport is concerned. Coming to the more concerning injuries, which is the overuse injuries in youth sport. So more than 50% of injuries documented in youth sport belong to this category, overuse injuries. Now, overuse, the name itself is self-explanatory. It is an outcome of a body part being repeatedly used. During each use, the trauma is very small, but then when it happens 1000 times, it is a very small trauma times 1000, which now becomes a substantial severity of injury. So this injury is very slow and very insidious to progress. It is mostly related to activity. So if you throw baseball, your shoulder will be subjected to this injury. If you kick the soccer ball, your adductors or the inside of the thigh will be subjected to these injuries. But what's really deceptive here, that the performance is not clear cut. Sometimes all that you see is a limp. Now, limp can happen because of injury to any part of the lower limb, ankle, foot, toes, shin, knee, thigh. Injury to any of these parts can lead to a symptom or a sign called as limp. So what is challenging about these injuries, that the presentation is vague and it's very deceptive, and hence the location of the injury becomes quite difficult. as opposed to acute injury where the child immediately communicates or presents to the coach or the PE teacher. In case of overuse injuries, it may happen very late, and in many cases it never really happens. Forget about the technical jargon of traction epiphysitis and tendinopathies. What you need to understand, and a PE teacher or a youth coach, is the most common location of overuse injuries in youth sport is the shoulder and the elbow, followed by the anterior knee. We did some studies in Singapore to see how the situation is here. So while you see in category of youth swimmers, we found that 19% of injuries in shoulder and elbow are of overuse nature. But if you look at football, look at pole vault and competitive softball, this is almost touching 70% and even more. So again, as I said, these data will differ from population to population and culture to culture. So it becomes absolutely paramount to conduct population specific studies to get a true understanding of the injury load before you start developing and implementing injury prevention programs. But what's critical, a take home message for every PE teacher, every youth coach, is if your young athlete or young pupil complains of discomfort, ache and pain persistently, like over a week or 2 weeks in a particular area which is used predominantly in that sport, you cannot and you should not ignore this. You need to quickly take a back step and look at the training load that the child is being subjected to. You might want to consider sending the child for expert medical opinion, or just give him off for about a week for recovery to happen. But any complaints of persistent discomfort, ache or pain at specific body sites should never be ignored as far as the young athletes are concerned. So now we have reached the focus of today's topic. After we have understood the context, we have understood the characteristics of the growing body, we have discussed the risks of injuries that the children are exposed to, we have whizzed through the common injuries that they are subjected to. Let's look at some of the approaches of preventing injuries in PE and youth sport. Now, preventing injuries is absolutely critical. It needs to be understood that if we are able to minimize the risk and incidence of injuries, if we are able to make physical activity and sport safe, it can lead to multiple beneficial or positive outcomes, both in the short term as well as in the long term, including in enhanced probability to retain the talent, reduce the chance of talent loss, and better able to nurture the talent in relevant talent development pathways. So it's absolutely critical, be it physical education or youth sport, active efforts should be done to minimize the occurrence of injuries. Now the question raises, while we talk about the predictability and the preventability of injuries, are we really able to modify them? Now, before we move on to modifying to preventing injuries, we need to have a quick look at the risk factors that the children are exposed to, because it is the risk factor that eventually predisposes the child to a high risk of injury. So if you see on the top of the screen are the boxes which have the intrinsic risk factors like motor skills, fitness, ignorance, less sleep, perceptions and so on. And the boxes below the line or the lower part of the screen have extrinsic risk factors like adult-like game format, training methods, rules, early specialization and so on. Now, why some of the boxes have been painted as green? Because these are modifiable risk factors, and the boxes that you see in dark yellow or light orange are the ones that are non-modifiable risk factors. So what comes to us as a clear piece of understanding that significantly greater proportion of risk factors are modifiable, and that should give us the belief that we should be able to substantially bring down the risk and the incidence of injuries. And who is going to do this? Of course, the physical education teacher, and also to a large extent the youth coach. And why?